found that a lot of firms don't have personnel manuals, and I've always thought it was important. Why do you think it's important for a practice to maintain an up-to-date personnel manual?
Right. Well, one of the things that frankly is very frustrating for me is I come across a lot of doctors that say, well, I'm working on writing my manual, or I've downloaded something online and I'm using that as a template. One of the things that I think many doctors don't realize that they are much more likely to be involved in a lawsuit or some kind of action against them or their practice from an employment issue rather than a malpractice suit. So they run the risk of claims as far as discrimination or workers' compensation or mishandling of a termination and such are much more likely than the fact that they're going to have some sort of malpractice situation with a patient. And so if they have a well-written manual that's been reviewed by an employment law attorney, it can really be their frontline defense against any kind of employment issues. So it's really important to have that up-to-date manual.
No doubt about it. Especially the other thing is sexual harassment, too, is another problem.
Right.
And if there's a well-written policy on how sexual harassment issues are dealt with, then that can be a definite savior for the practice.
Right. And what happens is it's the classic mindset of that will never happen to me. So the doctors don't think they need to have these protocols and policies and procedures in writing, but if they're ever brought to a courtroom and the attorneys and the judge are asking, where does it state that that's your rules or how did you handle the situation, it's certainly a lot more comfortable to be able to point to your manual that's been signed off by your staff than to say, well, I told them that's the way it should be.
No doubt. Now, does peak performers, health practices develop a manual?
Yes, we do. What happens is the format that we use is part of it is kind of a standardized language that any employer should have in their manual. And then there's portions of it that are customized. For example, how much vacation time do you want to allot people? What's your policy as far as vacation time? It can define who is eligible for an employee discount for services in the practice and so on. The other thing that's real important in a manual is to have a written job description. So we make sure all those components are part of an employee manual. And another benefit too is that by having a well-written manual, not only does it make sense from a liability standpoint, but I found that it just makes it the ability to manage the staff efficiently and consistently. So, when you have a well-written manual, the rules and the procedures are spelled out for everyone to be treated equally, which can really help the doctor reduce their stress and conflict within the team because they know that everyone follows these same rules and it's not one policy for so-and-so and another policy for somebody else. So that's another key component in making sure that it's important to have that manual for your practice.
Well, now, when a dentist is disabled for whatever reason and can't perform their services, obviously it can be devastating for the practice. Does your company work with dentists to develop a contingency plan to deal with these types of situations when they might occur?
Yep, we sure do. Unfortunately, many doctors don't really have a plan in place should they not be able to practice. I think many of them feel that it's something that won't ever happen to them, but I think any of us that work with professionals or just work in the business world know that it's been shown that people are really more likely to experience some sort of disability or illness during their career that prevents them from working. So they really should have a plan in place. So we've been given directions through many practices in setting up contingency plans, so to speak, regarding even just simple coverage for the practice to a complete formal plan for their family should there be a total disability or even a death occur. So those doctors who are prepared can actually spend their energy recovering, or their families can focus on other issues if there's a plan in place should something serious happen and the owner doctor unable to practice. And as in any professional situation, if that person is not able to see patients and generate income and revenues for the business, there's not much money to pay the bills. So we found it's really important to help the doctors plan ahead and have some sort of action plan or contingency plan in place should the worst case scenario happen to them and they're unable to work in their practice.
I think it's great that you're emphasizing that to your clients, because I'm sure it's just like on our previous discussion about employee manuals that a lot of dentists think, they're in their 30s or 40s and they don't have any idea that anything bad can happen to them, any catastrophic event. So it's good that they have a plan in place to deal with that. So. Right.
And it doesn't really matter what age you are or what stage you are in your career. You never know what life holds for you, and if it throws you a curveball and you're not ready to do it, it can make a real mess for not just you, for your family as well.